A cleft palate happens early on in a mother's pregnancy, and it's when the roof of the mouth doesn't completely form or fuse together, and that causes an opening between the mouth and the nose. A baby has difficulty obtaining or maintaining suction when they are born with a cleft palate. I like to use the analogy of drinking from a leaky straw. It's really difficult and you have to work really hard to pull the fluid from the apparatus into your mouth. The ideal bottle for an infant with a cleft palate is one that allows self-pacing. This allows the infant to control the flow rate of the nipple. The assisted methods of feeding, such as the squeeze bottles, tend to generate more ingestion of air because you're squeezing them, whereas the Dr. Brown specialty feeding bottles have a special vented system which allows the milk to flow freely and they ingest a lot less air with their feeding. The Dr. Brown specialty feeding system is good for helping reduce the amount of nasal regurgitation because it has that specialty feeding valve inserted into it, and it helps control the flow rate of the milk, and the infant's actually able to control the flow rate themselves. There's a specialized valve that we insert into the nipple. It's a one-way flow valve. Once the nipple is primed, it prevents the milk from falling back into the bottle. So the nipple becomes full with milk, stays full with milk. To prime the nipple, I like to squeeze the tip of the nipple, tip it over, and then put it right side up again as I'm releasing it. The nipple should be filled about 3/4 full with milk at that point. My favorite things about the Dr. Brown specialty feeding system are that it looks like a normal bottle that every mother they use. It doesn't look like a specialty feeding bottle. It's a fully reusable system, and it's also really easy to clean. It's also a great transition bottle. After the infants have their cleft palate repaired, they won't necessarily need that valve anymore because they will be able to create suction. So you can remove that specialty valve and just use it like a regular bottle. I recommend the Dr. Brown specialty feeding system because it's an infant pace system, so the infant's able to control the pace or the flow of the milk, which is really important because we don't want them to get too much milk too quickly, but we don't want it to go too slow, and so this way they're able to control the flow and feed more effectively.